Welcome back. This is Sarah and Whitney. So we had such a good response from the Hey Whitney section.
Yay.
We're doing it again.
Heck yeah, I'm here for it.
All right,
Let's do it.
Let's do it, Whitney. Okay. Today's first up. Hey Whitney, I'm finding myself being obsessed over things. My baby's sleep schedule. My friend tells me I'm obsessive because I constantly wipe down things. She says cleaning everything and carrying Clorox wipes is too much. What is she talking about? I just am trying to keep everything clean for my baby and me.
So it sounds like we could have some postpartum OCD going on. And I will say, I think post-COVID, that has gotten more prevalent.
Yes.
Especially, which I had a 2020 baby, especially in 2020 and in the early parts of 2021. We didn't really know what we were up against with COVID, and it was scary.
Yeah.
You know, I worked in the hospital during that time, and it was very surreal.
I was pregnant during it, yeah.
Yeah. It was very surreal to see the measures that we had to go through as a hospital, especially when we would start to hit those surges.
Yeah.
You know, we were converting non-patient areas into patient areas. We were converting our GI lab into an ICU because we needed more COVID ICU rooms. So the contamination fear is legitimate.
Yes.
So just know, if you struggle with postpartum OCD or perinatal OCD, it's founded because you ultimately want to keep your baby safe.
Right.
And that is the goal of that.
And I'm sure this viewer, it's, you know, the Clorox wipes taking everywhere.
Mm-hmm.
I could see what she's trying to do there.
Yes. Well, again, you know, in COVID times, we didn't know, is it a contact infection?
Right.
Is it droplets? Like, again, we just really did not know what we were up against. And sometimes I wonder if we still don't know what we're up against, you know?
Right.
So I want to reassure this mom that your motivation to keep things clean for your baby to be healthy is a good motive.
Right.
You're not wrong for wanting your baby to be healthy and for things to be clean. What is slightly concerning to me is how often do you have to wipe something down for you to know that it's clean? Are you wiping down the refrigerator handles 10 times because if you don't do it 10 times, it's not clean? That's what we call a compulsion.
Okay.
So if you have to complete an action so many times for you to believe that it's truly clean or disinfected, that is a compulsion to the obsessive thought of it's not clean. If I touch that refrigerator door handle, I'm automatically, inevitably going to get sick and my baby will get sick.
Yeah.
So your obsessive thought is that's dirty. If I touch it before cleaning it, I will get sick or my baby will get sick. There's no ifs, ands, or buts to it in the thinking. It's inevitable.
Okay.
So then the compulsion comes along of, well, if I wipe it down, then I'm safe.
And then I do it repeatedly.
So there's that compulsion to make the obsessive thought go away.
So you're self-trying.
Oh, yeah.
Yeah, you're trying, but it's not.
So the goal.
It's getting a lot. Yeah. I could see the background of that for sure.
Yeah. So when we struggle with OCD, the compulsion is supposed to make the obsessive thought go away.
But it just makes it worse?
It just makes it worse. Okay. It feeds into it. So it's kind of one of those, which dog are you going to feed?
Mm-hmm.
When we feed the obsessive thought of, oh, well, I completed this, it's clean, I can open the refrigerator door, everything's fine. So you open the refrigerator door, you get out your yogurt or whatever it is that you're getting, and you get that one item. You get the one item that you wanted, and then you shut the door, and then you realize, oh, I wanted tea to drink. Then you think, oh my God, but I touched the handle. It's dirty. I have to clean it again. So it feeds to that obsessive thought that nothing is ever clean unless you just wiped it down so many times.
How do you break that?
So one thing to remind yourself of, and this is actually something that my chiropractor told me, because we were talking about COVID and all those kinds of things. And he goes, an exposure does not automatically lead to an infection.
Right.
So, for example, my daughter had RSV last week. She sneezed and coughed right into my mouth.
As they love to do.
Yeah, it was super great. I really appreciated that.
I've taken it to the eye before.
Yes. So I was, super thrilled that she did that. Sharing is caring, apparently.
Yes.
And it happened multiple times. So that was super fun. And I just kept thinking, oh, I know what my fate is in the next 3 to 4 days. Comes and goes. I didn't get sick.
Yeah.
And I kept thinking, how? Because clearly it got into
contact.
Oh, direct contact into the system. And I'm like, I'm so sorry, immune system. And here we go.
My child has no cares.
No. Especially at, 21 months.
Yeah, no.
Yeah, no cares were given. And so we know I had that exposure. A direct exposure. A very disgusting exposure.
Yes.
I didn't get infected. And I'm not here to say, oh, I have this great immune system, because I certainly do get sick. But an exposure doesn't automatically mean infection.
So changing the way we think about that.
Absolutely. And you got to think, too, yes, we are here to protect our babies, especially when they're newborns. That little immune system does take time to build up, even if you're breastfeeding.
Yes.
Even if you're breastfeeding and they are getting those antibodies in your immune system through the breast milk, it takes time for it to build up. So naturally, yes, we want to keep our babies safe. I am here for that. Don't hear me saying just let your baby be out and about amongst all the sickies. Not saying that at all. But as adults, unless you have an immune-compromised immune system or an autoimmune disease to where you know that you are more susceptible to diseases, you're allowed to trust your immune system and tell yourself that.
So if she's in that moment and she's reaching
for the door handle,
and then she goes, I need a wipe, and she recognizes I've already wiped 4 times before.
Yes. That she's safe.
She's safe.
Unless there's something like visually dirty about it, you're safe.
So reminding herself in that moment
that she can trust her immune system, which means she can trust herself to keep her baby safe and healthy. Because that's ultimately, I think, maybe the root of some postpartum OCD.
Right.
And that if she does get sick, it's probably going to be fine.
Right. So reframing to more realistic view.
Oh, for sure.
Because it is, I look back and I think I had obsessive tendencies about Will's sleep schedule.
Oh, yeah.
To the point of to the minute.
Oh, yeah.
And I now, with the second child, and not suffering from postpartum depression or anxiety, OCD, looking back and saying, okay, that 1 minute, if he woke up early, that would really send me over the edge.
Oh, wow.
So now I'm realizing I was obsessive about that.
Absolutely.
And I felt like I could control him maybe. And so that I resonate with that mom. We're controlling something, right?
Yes.
That we feel.
Well, because in postpartum, what do we have control over? Not a lot.
So I remember people even saying, Sarah, you're too strict with the schedule. Sarah, you're this. So looking back.
That's what it was.
I wish somebody would have said that to me. So with this mom, it does get better.
It does get better, absolutely. So reframe it. You're allowed to trust yourself. Your motive is good. Your motive is there to keep your baby safe.
And it's so new, this new baby, or even if you're the 4th time mom, we still have this underground inside of us protective, we're going to protect this child and keep it safe.
Well, and every child is different.
So true.
Especially if a mom had a NICU baby or a preemie, where you do have to be hyper vigilant.
And especially depending on what season they're born.
Oh, yes, I have a January baby. My oldest is a January baby. So, peak cold flu RSV season. She was a newborn.
Yeah.
So we had the rule, and this is pre-COVID, so masking was not something that was really done unless you were in the OR kind of thing.
Right.
But it was one of those I said, if you get sick, you have to be well for 2 weeks.
Yeah.
Before you can come see her. No kissing the baby.
Oh, I'm big no kissing the baby.
Yeah, big on no kissing the baby, which was really difficult for my dad because she was the first grandchild.
It's harder, I feel like, for older generations.
Yes, he wanted to so bad.
Pass the baby,
Oh, good gracious, yes.
That was
Yeah, and, not to be controversial or political, that's not my goal here. But, I did have to tell family members you need to have your flu shot and your Tdap shot.
Right.
before you come because I don't want her to get the flu. I don't want her to get whooping cough.
And that's a boundary.
Oh,
and
for sure.
We're here to talk about boundaries too. The fact that you can set that for you and your family or you and your child or you.
Yeah, absolutely.
So boundaries are not necessarily OCD tendencies.
No, and boundaries are different for every person.
Right.
So there could be a mom listening to this that's like, I don't really see the point in doing that. That's fine.
Please, yeah.
That is fine. You do what is right for you and your family.
Mm-hmm.
So just be aware of that. What is a boundary for me may not be a boundary for you, or you may tweak it to be a boundary for you. You know, all of those kinds of things. Like my husband's stepmom, she has had a severe reaction to a vaccine in the past, so she cannot get the flu shot. She told us that up front.
Right.
But she also knows if I'm sick, I can't be around the baby.
Right.
So it's one of those too. If you have one of those situations, you have to just kind of work with that boundary.
Yeah. And I think it's totally okay for loved ones to bring OCD tendencies to you in a loving way.
Yeah.
And just say, hey.
I've kind of noticed this.
Right. Or if you have a friend that you're listening to us and you're going, that reminds me of
so-and-so. In
a loving way of saying, let's talk about it. Or, you know, is there maybe something underlining there?
Yeah.
So having open conversations. But to that mom, you know, like Whitney said, you're valid.
Oh, yes.
In what you're doing, and just reminding yourself in that moment, you're safe. And is there any way for her to like stop herself from grabbing a wipe?
Well, okay, so here's one thing. It's a little bit of a CBT kind of method here. And so just see if you can wait 5 seconds.
Okay.
Say, oh, I need to go grab the Clorox. Wait, let me count to 5. Let me count to 5. If you can get to that 5, say, okay, can I count to 5 again? Try to get to 10 seconds where you hold off on that compulsion. And then if you need to wipe it down once, you're allowed to do that.
So you have like a pass for that one time.
Yeah.
Yeah.
Because it's not bad to want to clean things.
No.
It's not bad at all, especially if you have older kids. There are germs everywhere, all the things.
Right.
And so it's okay that you do those things, but try to stop yourself. Try to get to 10 seconds out and be like, okay, now I'm allowed to wipe it down once.
Right.
That way you're not feeding into that obsessive thought.
And then with the same with my sleep, what could have I done differently?
Well, I will say I do think our culture or our society is pretty heavily focused on baby schedules. And not saying that any of this is wrong. It works for some people, but you know, mom's on call, taking care of babies, you know, all these different methods to get.
Which I was a taking care of babies mom and a mom's on call, and I love, but what I did wrong was I obsessed over perfecting and hearing other moms. My baby's this magical baby that sleeps through the night at 2 weeks. That unicorn baby I've heard of. That I'm going,
where's that? Yeah, where's my unicorn?
Yeah, both my children.
Yeah,
no, they're knock on wood. Sleeping, and I did sleep train, but I was obsessive over if they said your baby, especially moms on call, gives you very structured days. I couldn't look past. Yeah. Well, if it's supposed to go to bed at 7, but they wake up early, that's not going to happen. Yeah. It would just derail me.
So one thing to realize is that no baby is the same. And that those schedules are suggestions. Right. So, because I can remember with my oldest kind of getting obsessed over, well, is she supposed to nap at 10 or 10:30 and da-da-da? And it was so, I could not get her on a clock sleep schedule. It was not going to happen. And then she was going to be a daycare kid. Yeah. So I'm like, that's going out the window anyway. What I would encourage moms to do, try to throw away the clock. Throw away the clock. Look at your wake windows.
That is something that was huge for me learning. And taking care of babies was wonderful. And, you know, they have an Instagram. They provide a lot of free tips.
Oh, that's good to know.
Lots of free tips. Kara was a pediatric nurse.
Oh, okay.
Maybe NICU, and her husband's a pediatrician.
Nice. So they have the knowledge.
And the moms and calls are nurses. But there's plenty of, we're not just saying those
Yeah.
two, we're saying there's plenty of resources out there.
Absolutely.
But
But focus on the wake windows, and it's okay if baby doesn't even follow the wake windows to a T.
right. Yes.
Like, I promise you, it may feel like the end of the world, but it isn't if they go down for their nap 5 minutes later than you anticipated. That's okay. You're not a bad mom. They're not a bad baby.
That's a huge thing that I had to take in, is that just because my child's not sleeping.
Yeah.
Which if you go back to sleep was I needed it
Yes.
so bad.
Mm-hmm.
That I equivalent him being good with sleep.
Oh, yeah. Yep, that's pretty common. And then if you have a fussy baby, then they're a bad baby, and that's not the truth.
Exactly.
That's how babies communicate.
Mm-hmm. Especially if, I don't know if you ever did the Wonder Weeks.
Yes.
With
huge
leaps.
fan of that.
Leaps,
Huge
sleep
fan.
regressions.
Mm-hmm.
To me, it helped having a little bit of a why behind it.
Mm-hmm.
You know, some people say, oh, that's, this or that. But to me,
It was pretty spot on for both my
helping
kids.
me know how they're seeing the world
Yes.
and giving like a little bit, okay, no wonder.
Yeah. It's basically like a developmental growth spurt.
Yeah.
So any mamas listening, Wonder Weeks, there's an app. It costs like $3 or $4. I think there's a book you can get on Amazon too for less than $20.
Yeah, the app was great for
And
me.
I loved it. Highly recommend it. Because if your baby just seems inconsolable and you're like, what the heck is going on with my child? Why are they acting this way? All that kind of stuff. They could be in a leap.
And that is something I don't feel like other generations talked about, because I've spoken to my family members about it and they're like, what's a leap?
Mm-hmm.
Are they always in a leap? I hear that. And I'm like, well,
it feels that way sometimes.
Yeah, there's stormy days in a leap. There's sunshiny days, which you, on the app, you put in their due date or their birthday and it literally maps it out.
Yes.
So highly suggest that, moms. And sometimes
super helpful.
Just to say, there's a little bit of a reason why.
Mm-hmm. You're not a bad mom and they're not a bad
mom,
baby.
And you're not a bad kid. And don't compare yourself to others.
Yeah. Think of it, when we go through life transitions, we tend to have a change in our mood.
Oh, 1,000%.
Same thing with your baby.
Absolutely. Well, that's a wonderful question. Now, this one's kind of this one's resonates with me, and see what you think too. I don't feel attached to my baby. Everyone says it's love first sight, not for me, and what is wrong with me?
Well, first off, there's nothing wrong with you. There's not. And I think every mom is different, because some people say that they bond with one of their children immediately and other children they don't.
Right.
I think a lot of it depends on what happens during pregnancy. Was it a planned pregnancy? Was it a surprise pregnancy? Was it a complicated pregnancy? Did you endure any type of traumas or losses or major changes during that pregnancy? Did you have a traumatic delivery? Did baby have to go to NICU soon after? Or it could be everything was storybook and you're like, I don't understand why I feel the way that I feel.
Right.
So something to be aware of when we don't feel bonded with our babies, or we feel like there's a level of separation or like a dissociation almost, that's a protective measure. So for example, when I was pregnant with my younger daughter, we found out we were pregnant in January 2020. So this was before COVID hit here in Alabama, before things got shut down and all that. I found out at 4 weeks I was pregnant with her. At 5 weeks, I started having severe pain in my left ovary. Now, a little backstory, when I had to do infertility treatment to get pregnant with my older daughter, my left tube was blocked, we found out. So automatically, because the pain was lasting for several days, and it was severe when it would hit, I thought, this is an ectopic pregnancy.
Which is essentially the babies in
the tube, not the uterus.
Which is not, as you can imagine.
It's not ideal. Most of the time they have to do a surgery to remove that ovary and tube, because it can be life-threatening for mom otherwise.
Absolutely, yeah.
So, and again, I worked in labor and delivery for 9 years. So I felt like I had some medical knowledge of what to expect with an ectopic. I felt like my assumption was realistic.
Yeah.
And so I go to my OB, they do an ultrasound. Turns out I actually had an ovarian cyst rupture.
And those are incredibly painful.
They're very painful. I had never experienced one up until that time. So that's why I didn't think it was a cyst. And also, so many people that I had known that had cyst rupture, they bled.
Yeah.
I wasn't bleeding.
Mm.
So that's what made me think it was ectopic. So that's how that pregnancy started from the get-go at 5 weeks, had that cyst rupture. So I was very guarded in who I told that I was pregnant.
Yeah.
A lot of my coworkers knew, again, I worked in labor and delivery. They were nurses, so I felt like I had some camaraderie with them. I felt like if something went wrong, they were there for me.
Mm-hmm.
We did not tell our family until I was 13 weeks along with her and had my HCG drawn a million times, it felt like, had the chromosomal blood work done to make sure there were no abnormalities,
Right.
things of that nature. So I was very guarded, very, very guarded, because I felt like if I did lose the pregnancy, it wouldn't hurt so bad.
Exactly.
So I was protecting myself by choosing to not bond.
Right.
So it was end of February 2020 when we told our family that we were pregnant with her. And so 2 weeks, no kidding, 2 weeks later is when COVID hit and everything got shut down here in Alabama. So then, again, working in the hospital, PPE shortage.
Yeah.
And I'm pregnant. And I'm like, oh, we don't know what we're dealing with, all that kind of stuff. So there's an element of fear because of the unknown. And so, again, kind of guarded because I'm like, I don't know what to expect with any of this stuff, you know, and nobody did. Well, then fast forward to April of 2020. I was 19 weeks. It was the week I was supposed to have my anatomy scan done. And I kid you not, that Monday, Tuesday, Wednesday, and Thursday, those 4 days in a row, there was a mom who had experienced a stillbirth. Each and every single one of those moms were between 18 to 20 weeks along in their pregnancy.
So just like you.
And they were pregnant with girls.
Just like you.
Just like me. I was beside myself. And you know this from working in medicine, things come in threes.
They do.
So when that fourth one came in, I was the biggest ball of nerves.
Yeah.
I went into my OB appointment that week, nearly in tears in the waiting room because I was just convinced I had lost her.
Yeah.
And at that point in your pregnancy, you have to deliver. A DNC is not an option at that point in time.
Right.
And so either way, traumatic.
Oh, yes.
Either way, traumatic.
Yes.
But I knew what was coming, and I just kept thinking, how am I going to deal with that? Can I deal with that?
Yeah.
So I remember going in. Blood pressure was through the roof, which I told them I knew mine.
As it would be.
Yep. I was like, oh, I'm anxious. I'll tell you why my blood pressure's high. And so I go in for the ultrasound and everything's fine. And you would think that that would give me a sense of relief. You would think that I felt like I could breathe a little bit. And in that moment, I could.
Yeah.
In that doctor's office, I could. The minute I stepped out, all of a sudden that fear came back.
It hit you.
Oh, absolutely.
Yeah.
And so, again, COVID, working in the hospital, all the things, I felt very distanced and unengaged with my daughter during that pregnancy because I had this fear that I was just going to lose her.
And that makes so much sense.
And I just kept thinking, if I don't get attached, it won't hurt so much.
That, you know, you're sharing your story and I'm going, that's what happened with us as well.
Oh, yeah.
You know, we had miscarriages.
Mm-hmm.
And our first pregnancy was a miscarriage.
Mm-hmm.
I never, some of my friends have had no experience with miscarriages.
Yeah.
And they've lived what I've thought just kind of like joyful pregnancies.
Yes.
And me, it felt like when I miscarried at 13 weeks and we knew it was a girl, pull the rug out from under, it's just that. And I felt so much shame with the miscarriage and telling people. We had just posted on Facebook the week before.
Yep.
And after that, then we got pregnant with Will.
Mm-hmm.
I did not tell a lot of people until I was 6 or 7 months pregnant. Obviously, we were in Boston at that time, and my coworkers knew and my immediate family. But and I was afraid to lose him, so I thought if I didn't almost say it or recognize it, like you were saying.
We protect it.
Yeah. I was trying to protect him by not recognizing it.
Mm-hmm.
And then, his birth was wild, 6 weeks
Yes.
early. And, we
Uh-huh.
survived the worst. But then we had another miscarriage between him and our youngest son, James.
Mm-hmm.
So when I got pregnant with James,
Yeah.
I always envisioned losing him because I've had such this, like you said,
Yeah.
like a history, of it, right?
Mm-hmm.
And then when he came in, and I don't know if it was the 1 to 2 transition.
Yes.
That's hard.
Mm-hmm.
Moms, let's recognize that.
Yeah.
Okay, it's hard.
Mm-hmm. It's a transition.
Transitions are hard. We loved him,
Oh, yeah.
but it was hard.
It's different.
And so I think to this mama, look back maybe and
Mhm.
say, is there
a reason you feel like you need to protect? Was there a traumatic delivery? Was there a NICU stay? Was your baby a preemie?
right?
Is your baby medically fragile?
Did you fear through this pregnancy?
Yeah. Do you have a history of miscarriage or losses?
Did you try, fertility?
Yeah.
The fertility journey.
Oh, it's not for the faint of heart.
So you're constantly probably told worst case
Mhm.
and thinking,
Or we envision worst case.
right?
If you're a medical mama,
Oh, that's, yes.
if you are a medical mama, whether you work in pediatrics or you work in labor and delivery,
yes.
there's probably always that little voice in your head that's like, are you sure it's safe?
Or hearing a loved one or someone I remember around James's birth, there was a reality star that was due the same time as me who lost her baby.
Oh, that's awful.
And then you start like your experience.
Mm-hmm.
If it happened to her. So I think it's valid.
Oh,
it
for
does
sure.
not define you as a mom
It
to
does
feel this way.
not.
It does not change that you love this child.
No, not at all. You love that baby, but some things that can help you begin the bonding process, regardless of what your feeding choice, whether it's breast, pumping, or formula feeding, you can do skin to skin with that baby.
Yes.
I did skin to skin, especially with my younger daughter once she was here. And so I was able to do that with her, and that helped significantly.
So much.
It really does. You do actually feel like you can bond with that baby.
Uh-huh.
Reading to your baby. That's another big one that was always, really good for both my girls. I was really big on listening to music while I was pregnant. I would love to put my phone up next to my stomach and just kind of feel my girls kind of move around to it. And they liked different music.
Yeah.
And so it was really cool because like they each had their own style. So after they were born, I'm like, well, let's
see.
sit here for a minute and just listen to this music together again.
Yeah.
So, and I'm not saying that it's going to, happen overnight because it is a process, but you can build up on that.
And even, I know our youngest, he had reflux.
Oh,
he had dairy allergy, and the crying did not help.
Nope. Bet you thought you were going to lose your mind.
Many times.
Mm-hmm.
My husband and me actually went on a date to the rage room.
Nice. I'm a big fan of rage rooms. They really do help us get out our stress and
Super
anger.
therapeutic. Oh my gosh.
So therapeutic.
I'm
Mamas, if you're listening and you have any type of like rage or anxiety, anger, even life stressors, whatever, go to a rage room. Get that stuff out.
That was fantastic. And truthfully, I mean, because it's hard when you're already feeling detached or you're feeling, then your kid is experiencing, or they're just a normal baby who cries a lot because, babies cry a lot.
They do, unfortunately.
For no reasons.
Yeah, just because they want to stretch those lungs.
So that's hard.
Yes.
So that does not help the situation.
Yep.
But I realized too, gratitude to me helped.
Yes.
Naming some things in that moment I was thankful for helped change my negativity.
Yep. And it can be something little that you're grateful for.
This sandwich that I love that I'm eating right now, this Reese piece, something, I mean, there's some days that's all I could be grateful for.
Oh, yeah.
Because I had not slept all night. And as I said, it's just the night is a long, long time when your baby's crying.
Yeah. I mean, there's that saying of the nights are long, but the years are short.
Ooh.
That is so valid in those newborn days.
Those, especially like the 1 to 4 a.m.
Oh,
And then, because it's like once you
God.
get 4, you're like, I have to, especially if you have other kids or if you're trying to go to work,
Yes.
you know you're getting up in a few hours. And sometimes it feels almost worse to go to sleep than
Agreed.
to get back
Yeah.
up.
Mm-hmm. You feel like that grogginess is going to be
It's
there.
so hard.
It's hard.
So to this mama, you're not alone in this.
No, and you're not a bad mom.
And you love your baby, and your
Mhm.
baby does not know that you're feeling
Agreed.
this.
That's such a good point.
And this baby just looks at you, and you're keeping this baby alive. You're doing the
Yep.
best you can. We see
You are
you.
your baby's world.
We see you.
Your
You know.
baby is bonded to you, even
Mhm.
if you don't feel that way towards your baby.
Amen.
And that's okay.
And this is a phase.
Oh, yes.
It will get better.
Yes.
But to ask for those breaks too,
Mm-hmm.
some people are like, well, I don't feel attached. Why should I be away more? It's like, no,
Mm-hmm.
Let's-
You're allowed to take a break. It's not selfish.
no. It makes you a better you.
And sometimes, if you don't have family or friends nearby that you trust to take care of your baby or whatever, honestly, sometimes just getting in the car and going for a drive for a little bit can be a break.
Getting outside your house,
Yes, outside those 4 walls, they get smaller and smaller every day.
even if it's, if you drive to get a coffee,
I was about to say, you can go on up to Sonic, get you an order of tater tots
that's
and your
all you
favorite
need.
drink.
That's all you
Yes.
need. Just to get you a little something, a little treat for
Yes.
you.
Uh-huh.
Something
Listen
about
to your music.
something about car rides. Usually in those newborn days, put them right to sleep.
Yeah.
That was always a
Oh, yeah.
nothing else.
Yep.
Here we go on a drive.
Uh-huh. I've sat in many parking lots before with a sleepy child and my
Mhm.
little drive-through order, and I'm like, we're just going to hang here for a bit.
Yes, we are, and there's nothing wrong with that.
Nope. We got to do what we got to do, mamas.
But we're here just again to tell you, you're not a bad mom.
No. And you're not alone.
You're not alone. We felt this.
Mm-hmm.
Once again, we appreciate y'all taking the time. We're here for you. Till next time, Whitney, we will have more.
Have a good one.
All right.